Thank you. As he said, my name is Mindy Ulstad. I'm the chief of the Bureau of Senior Programs here at the Department of Health and Senior Services, and I'm also the state lead for the Missouri Master Plan on Aging. Go on to the next slide. There are 7 life domains that we included in the Master Plan on Aging, one of which was transportation and mobility, and that's where we're going to spend our time today. So next slide. I just wanted to show you that we did have input from over 10,000 Missourians into the development of this plan. And so there's a breakdown there so you can see how many attended each event. But the majority of the comments came from the statewide needs assessment and those town halls. And so every comment, there was over 20,000 comments in total that were analyzed and used by the subcommittees to develop these recommendations. So next slide. And then I just broke down within the master plan on aging how many recommendations there were for each of those life domains and then how many action items each life domain had. And as you can see, transportation and mobility had 7 recommendations and 42 action items. So next slide. We did break down within the master plan on aging, and these are just kind of little cheat sheets that are in the master plan, but it'll be useful as you look at the recommendations and action items. So we wanted to categorize each of the action items by the level of effort to implement them. There is not dedicated funding to the master plan on aging, but as you can see, we do have low and medium effort action items that don't take a substantial amount of funding or no funding, or they don't take a lot of like legislation or things like that to implement. So we wanted to highlight those because we know those can be implemented without a lot of additional funding. And then we also had a lot of crossover between the different 7 life domains that had subcommittees. And so we've identified each time there's a crossover between subcommittees too, that you'll see as we start looking at those action items. Next slide. There were some major cross-cutting priorities that we saw as we looked at the recommendations across the 7 life domains. Navigating services, we heard in all 7. So really making sure that people know what's available to them and how to access those services. We heard that over and over. And then there was a connection that came up between transportation and housing that we thought was important to point out that as we're planning housing for people, we need to make sure that transportation is thought of and connected to that housing to make sure people can get to where they need and want to go. Next slide. And so I wanted to just kind of run through very quickly the recommendations, and then you'll have a copy of the slides to look at all the different action items. We don't have time to go through all of them. But I think as you see how we were going through these, it'll make sense how we did these. So the first recommendation is to support state investments in transportation infrastructure to leverage federal funding. And what we recognize is that we really need to be strategic in our investment in public transit, active transportation infrastructure, and mobility services to enable us to more fully leverage those available federal transportation funds and make sure we're prioritizing state funds in a way that helps modernize systems, improve access, and reduce long-term costs for older adults and adults with disabilities. And so you can see there's 8 different recommendations that are tied, or action items that are tied to this recommendation. The very first one is to continue investment in the METAP, which is a dedicated general revenue fund that goes through MoDOT to providers for older adults and adults with disabilities to receive transportation. And then also to make sure that we're reducing any hurdles for local match requirements that prevent providers from accessing those federal funds. So trying to think about it more holistically and how we can draw down federal funds and make funding available to our providers in the state. One other one I wanted to point out on there is something that hasn't been talked about a lot in our state, but other states are looking at investments for low-cost repair programs for older adults to address those transportation roadblocks. So being able to give older adults either low-cost loans or have a grant program to help them repair their own vehicles so that they don't have to put more of a burden on transportation systems that are already overloaded when it's not necessary. Next slide. The next recommendation was to support expansion of coordination among agencies and transportation modes. This one was especially important as we think about how we can work together with our transportation systems to work across regions, providers, and services to improve access and efficiency. So really thinking about gap analyses to determine where we could do a better job of partnering between agencies and how we can use shared service models to provide additional options for people to get where they need and want to go. And this included everything from working with regional transportation providers, expanding use of regional call centers and booking apps for people to be able to have access to, engaging those public and private partners. So how can we work with things like churches and senior centers and SB 40 boards to work together and share the transportation options that they have? Again, how do we increase funding for providers and invest in those state-supported mobility management infrastructure? So these are all things that we want to be working on as we launch the Master Plan on Aging. Next slide. The next one was to improve or implement programs to assist with vehicle and driver shortages. Nobody on this call is going to be shocked by the fact that we don't have enough vehicles or drivers to get people where they need or want to go at the moment. So really thinking about how we can leverage reliable transportation services and really be able to use the vehicles that we have to utilize, trained and dedicated driver workforce and addressing maintenance and procurement and workforce compensation and insurance challenges we know are going on in the state. So we can make sure to work on the infrastructure and make sure that there is a reliance on transportation that people can count on. So there was multiple things in here, but it really did include, looking at how do we expand electric vehicles and alternative fuel sources? How do we work with the Volunteer Driver Tax Appreciation Act to increase charitable mileage for those volunteer drivers? And how do we increase pay for transportation drivers and address those pay differences? So again, just trying to look at different ways to look at how to fix these vehicle and driver shortages. Next slide. There was also a recommendation to encourage innovation and flexible transit options, including rural communities. Again, I don't think anyone on the call would be surprised to know that rural residents state that they don't have access to reliable and consistent transportation. And so we really want to make sure we're promoting innovations that improve the first last mile connectivity, increase regional mobility, and ensure residents in all areas, including rural communities, can travel easily across county lines, and access other transit modes. We want to make sure that we're supporting the existing MoDOT funding, that we don't lose that funding, and that we work with different providers like New Growth Transit and ITN to make sure that we're looking at all possible options to use innovative and flexible transit options. And expanding microtransit for that first last mile connection to public transit. So again, thinking about ways that we can connect all the different transit modes to make sure that people can get where they need to go when they need to go. Next slide. The next recommendation was to provide education and training to older drivers, including safe driving, information about transportation options and other than personal vehicles, and how to use mobility apps. So really making sure that we're providing that education and outreach to older adults and individuals with disabilities to make sure that they feel safe and confident using available transportation options, and developing user-friendly guides and making sure that we have those available and develop training programs to help reduce confusion and promote independent mobility for those populations. Next slide. The next one was to utilize the built environment concept when developing or revitalizing infrastructure to assure community walkability, increase pedestrian safety, and provide accessible and connected transportation options for travelers of all ages and abilities. So really making sure, again, that we're investing in a walkable and age-friendly infrastructure to promote walkability, promote people being able to ride their bikes and stay active in their communities, and work with state and local planning to make sure that streets and neighborhoods encourage movement, transit use, and aging in the community. Next slide. The next recommendation is to ensure older Missourians are engaged in meaningful ways to determine what the transportation and mobility needs are and what solutions work for them. So really just making sure that as we make these plans and we continue to work on addressing mobility in Missouri, that we're including older adults and adults with disabilities in those conversations on those commissions, councils, and advisory boards to make sure that we're using their real life experience as we do the planning. Next slide. So within the plan, we also included examples and promising practices. We wanted individuals or organizations that want to implement some of these local things on a local level would have examples to look at. And so we did include examples, and you can see some of those there. Next slide. I do want you guys to keep up with what's going on with the Master Plan on Aging. We do have a dedicated webpage that will be updated on January 2nd with all the new information once the plan is delivered to the governor. And we also will be hosting ongoing subcommittees for each of those life domains. So if you're interested in remaining on a subcommittee or joining a subcommittee for mobility and transportation, please reach out and let me know.